Okay. Uh, Hello, everyone. I'm Dr. Hassan, Dr. Khaled Hassan, Associate Professor of Clinical Pharmacology. We already spoke about the sympathetic system last time, about the originate of this sympathetic system from the thoracic lump and from the thoracic spinal cord and lumbar spinal cord, how this neurons, presynaptic neuron interact with the ganglia, then originate postsynaptic neuron to release norepinephrine and epinephrine. Today we are going to speak about synthesis and release of neuromediators called norepinephrine. So related to our topic for today's session. So what we have here. Okay, so we can see the first the tyrosine as amino acid uptake by the neurons, presynaptic neurons, uptake through the sodium tyrosine cotransporter. Then the tyrosine enter the neurons. So you can see that tyrosine enter the neurons. Then the tyrosine convert to the L-DOPA through the effect of DOPA decarboxylase. L-DOPA convert to the dopamine, and the dopamine enter the vesicles. Inside the vesicles, the dopamine convert to the norepinephrine. Okay, and we still is inside the vesicles. When the calcium enter the presynaptic neurons, the start digging. This start digging on the synaptic wall. This is number one, and the vesicles engulfing with the presynaptic edge here. Okay, so engulf and the presynaptic end and release the contents of the vesicles. And the main contents in this junction here, or in the synaptic cleft here, the main mediators here will be norepinephrine, and abbreviation NE stand for norepinephrine. Now the norepinephrine arrived to the synaptic cleft. As you can see here, the blue dot or the blue balls here, this granules. Okay, we have fate. What is the fate of this neurotransmitter? Number one, okay, when the norepinephrine release in the synaptic cleft, in the synaptic gap, okay, number one, to binding to the postsynaptic receptor. So number one, binding to the postsynaptic receptor, or number two, binding to the presynaptic receptors. So we have alpha 2 receptors, or binding to the postsynaptic receptor alpha 1 receptor. Number three here, reuptake by NET, which is stand for norepinephrine transporters. Reuptake this transmitter again and take it to the neuron to reuse it or recycle. So what we have here, we have fate. Okay, the fourth pathway for the norepinephrine to metabolized by the enzyme called COMT or MOA. COMT stands for catechol-O-methyl transferase and monoamino oxidase. So if you like to remember this enzyme or another substance or agents, we have ase at the end. We have ase as suffix. Monoamino oxidase. We have catecholamine transferase. So this is two enzymes. These two enzymes are responsible for metabolism of norepinephrine. Okay, so if you talk about any substances that able to block the COMT or MOA enzyme, if we block this enzyme, the result will be increased activity of norepinephrine. So we are going to speak about agents or drugs that will be able to block these enzymes, and later on, maybe after a few minutes. Okay, so now in order to memorize the information what we have here, we have three pathways or three fate for the norepinephrine. Number one, binding to the postsynaptic receptor. And what we have here, alpha-1 receptor, lead to the pharmacological response or physiological response, depends on the case. Number two, binding to the alpha-2 receptor. Number three, reuptake by the norepinephrine transporter or metabolized by oxidase, monoamine oxidase, or COMT. Okay, if we look a little bit closer here, what we can see there. Okay, so we can see the alpha-1 through the activations of G protein, and this G protein called GQ protein. GQ protein lead to increased activity of IB3 and DAG, which stand for inositol triphosphate and deacylglycerol. And this will lead to increased level of calcium inside, increased level of calcium inside the cells, and increased level of calcium inside the cells responsible for activations or for action potential, and these lead to the physiological or pharmacological response. Moving a little bit up about the G2 receptor. G2 receptor work through binding to the GI protein, and the GI protein here stand for the G inhibitory protein. This leads to decreased level of cyclic AMP, and this will lead to inhibitory effect. Okay, now we can move a little bit. So this one also to remember, we have three main parts of the synthesis release of norepinephrine from the adrenergic neuron. We have presynaptic neuron, synaptic cleft, and postsynaptic cleft. What about our medications? Where is the sites of medication? So the effect of medications on this synthesis release and reuptake of the neurotransmitters. Okay, moving to another image here. Okay, this is the same image, the same diagram, but we can see the drug effect there. So what we have here. Okay, moving to the drug effect on the synthesis release uptake of. Okay, so what we can see here. Okay, what we can see here, we have several medications. We have several medications here: reserpine, we have selegiline, mebramine and cocaine. Then we have entagabone, we have amphetamine. These medications affect the synthesis, release, and reuptake of neurotransmitter. So when you look on this diagram here and minimize or shrink this page a little bit, we can look on the reserpine. Reserpine, a block catecholamine storage. Reserpine. So the reserpine effect will be okay, inhibit transport of the neurotransmitter to the vesicles. This is the number one, reserpine. Okay, what about selegiline? Selegiline inhibit the enzyme monoamino oxidase. Okay, selegiline inhibit the enzyme called monoamino oxidase, and for this reason, selegiline used as antidepressant medications. Mebramine and cocaine inhibit the reuptake. And these medications, the first one used as antidepressant, and the second one used as a local anesthetic, and may cause, we talk about cocaine, may cause drug abuse because activate the dopamine reward system in the brain. Okay, the last one here, we have entagabone. Entagabone inhibit catechol transferase. Entagabone, and entagabone used for Parkinson's disease. What about amphetamine? Amphetamine is a medication used for the children suffer from ADHD, attention deficit hyperactivity disorders, and amphetamine work to enhance release of neurotransmitter. So the amphetamine enhanced release of neurotransmitter. Moving a little bit down to look on what we have in the table. Okay, so we have the summary in the table here. Reserpine, blood catecholamine storage, used for treatment of hypertension. Amphetamine promote catecholamine release. This medication used for attention deficit with hyperactivity disorder. Imipramine belong to the TCA, which stands tricyclic antidepressant. Inhibit reuptake of norepinephrine. This medication used for as antidepressant for depression disease. Monoamino oxidase inhibitor example, we have selegiline, increases stores of transmitter and that nerve ending, used for Parkinson disease. And the last one, COMT inhibitors. Examples here, antagabone, the antagabone used for Parkinson disease, reversible inhibitors, antagabone considered reversible inhibitors of COMT, which stands for catechol omethyl transferase. Thank you very much, and we are going to see each other again, talking about the same topic about adrenergic agent.